Long-term care planning for women who are alone, that means women who are single, divorced, or widowed, is very different than it is for couples. That's especially true when your health, your age, or cost is an issue. My name is Jesse Sloan. I'm director of the American Association for Long-Term Care Insurance and the National Advisory Center for Short-Term Care Information. Our organizations do not sell insurance, so after watching this video, if you have questions, speak to the insurance pro who sent you the link to the video. If you're not working with one, feel free to call our organization. We'll be only glad to connect you with a specialist. When it comes to long-term care planning, there's some really harsh realities that you're probably aware of, and that's that women live longer than men, and the result of living a long life is the added risk of needing long-term care. Indeed, 2/3 of all long-term care insurance claims are paid to women, and that's why women pay 20 to 40% more for long-term care insurance than men. Women on their own also don't have a built-in caregiver. That means in a couple, if one person is down for the count, as they say, well, the spouse can be the caregiver at least for a short period of time. A woman on her own doesn't have that. There are other financial considerations that come into play: income, lower retirement savings, lower Social Security. And that's why women who are on their own should consider an option that's typically called short-term care insurance protection. Sometimes it's referred to as recovery care. I like to refer to it as long-term care light. These policies provide up to 1 year of benefits. Some of the reasons that they really provide advantages to women, especially where health is an issue, is these policies offer simplified health underwriting, as you'll see in a minute. A key point is they offer the same pricing for single men as they do for single women. They can be issued up to age 79, and one of the attractive features is the zero-day deductible. I said that spouses, couples, have a built-in caregiver. A woman on her own who is independent, that zero-day deductible could be a key component because it means when you need care early on, this policy can be triggered and can pay for that kind of care. This particular slide shows actual rates for the medical policy. Now, again, we don't sell the insurance. You need to speak to an agent who can get the rates specifically for your state. But this will give you an example of what the policy would cost so that you could think about it and compare it with a traditional long-term care insurance policy, which at the ages that we're showing here is typically going to be much more expensive, especially for a single woman. After your 60s, about 1 in 4 to as high as 1 in 2 people who apply for long-term care insurance are declined because of health reasons. This particular policy asks 11 questions, and as long as you can answer no to all of the questions, you are 90 to 95% on your way to being approved. Thanks for watching this brief overview. To get more information, you now have to request a consumer brochure and actual rates specific to your age and your state. To do that, talk to the insurance agent who shared this video with you. If you're not working with one and want to be connected with a specialist, please call our organization. The phone number is 818-597-3205. Thanks for watching.